Okay, real talk. If you are here, chances are you have tried everything: more fiber, more water, magnesium, probiotics, herbal teas, maybe even stool softeners or laxatives. And still, your body just isn't cooperating. Maybe you haven't pooped in days, or you do, but it never feels complete. Or it takes 30 minutes of straining just to pass a rabid pellet. And at some point, you start to wonder, is this my life now? I want you to know you are not alone and this is not your fault. I have lived through this. Constipation controlled my life for years. I planned my day around the toilet. I've carried laxatives in my bag. I would go days without a complete bowel movement. I had fissures, hemorrhoids, the whole roller coaster. And the most frustrating part, I felt I was doing everything right. Almost eating clean, almost staying hydrated, moving my body, but nothing worked because I was solving the wrong problem. Constipation is not the problem, it's a signal, a downstream symptom of something deeper in your body, your brain, your history, or your habits. And unless you understand the root cause, it keeps coming back. That's what this video is about. With the help of our multidisciplinary perspective, gastroenterology, functional medicine, nutrition, physiotherapy, psychology, we built a map, a constipation root cause map. Not a list of tips, not a generic checklist, a way to help you actually figure out, why is this happening to me? And more importantly, what can I do about it? By the end of this video, you won't just feel more informed, you will feel more understood and more equipped to take your next step. Hi, I'm Bimal Maharzan, founder and CEO of GutSphere. All right, so here is the big idea. Constipation is a common symptom, but it can come from very different causes. One person cannot poop because their pelvic floor muscles are locked up. Another because of chronic stress shutting down their gut, and another because their thyroid is low, another because their gut bacteria are out of balance. The same symptom, completely different root causes. And that's why just eat more fiber doesn't work for everyone. So here's what we did. We grouped all known causes of constipation, backed by clinical research, experience, and patient stories into 10 root cause categories. Each category is based on a different mechanism, not just labels or diseases, but what's actually going wrong in the body. We call this constipation root cause map. In a moment, we'll walk through each category, but this won't be a lecture. I'm going to ask you questions. I want you to notice your patterns. Think of this like sitting with a really good clinician, one who doesn't just treat your symptoms, but helps you find your story in the symptoms. Here is how to use this map as we go. Number one, listen to each category like a detective. Number two, ask yourself, does this sound like me? And number three, when you feel a gut, yes, pause, jot it down. That might be your lead. All right, ready to find your root cause? Let's start with the most common, but also most misunderstood, functional constipation. This is when your colon and rectum look fine on scans and tests. Nothing's wrong, nothing's broken, but the system just doesn't move or doesn't coordinate. You might not feel the urge, or when you do, nothing comes. You're eating, you're drinking, but it looks like your gut hit the brakes. There are a few key patterns here, and I want you to listen closely for yourself. Some people have what's called slow transit constipation. Their food moves through the colon like molasses. They might go every 4 to 5 days. The stool is often hard, dry, and difficult to pass. These folks are usually cold, intolerant, sluggish. Sometimes they were like this since childhood. Others fall under IBS-C, irritable bowel syndrome, constipation type. They may poop some days, not others. There's often bloating, cramping, or pain relieved after pooping. Stress makes it worse. Meal triggers symptoms. Their gut feels unpredictable. Here's one that's often missed: pelvic floor dyssynergia. You feel the urge, you sit down, you push, and nothing. That's because the muscles supposed to relax during pooping are tightening instead. It's not your fault, it's your reflex gone wrong. And no amount of fiber can fix this. Some people train themselves to ignore the urge, always on the go or never near a clean toilet. Over time, the bread gut reflex weakens, and others develop constipation after a virus or food poisoning. The nerve gets disrupted and motility slows down. Pause for a second. Do you rarely feel the urge to go? Do you feel stuck even when your diet is perfect? Do you spend 30 minutes on the toilet and still feel incomplete? If you are nodding, this might be your cluster. In this case, you don't just need fiber, you need to retrain the system. We will show you how, but first, let's keep going. The next cluster: structural issues. When something's physically blocking the exit. Let's shift gears. What if the problem isn't that your gut isn't moving, but that something's physically in the way? This is the structural cluster, where something is blocking, narrowing, or distorting the passage stool needs to move through. It's more common than you think and often overlooked. Let's start with hemorrhoids. Not the little ones that itch or bleed. I'm talking about internal prolapsing hemorrhoids. The ones that bulge into the rectal canal and make it harder to push stool out. You might feel like you have to strain way too hard, or like stool is getting stuck right at the exit. Then there are anal fissures, tiny tears in the skin that hurt like hell. You start avoiding pooping because it burns and creates a fear avoidance cycle. Pain leads to withholding, withhold to harder stool and more pain. It's vicious, but treatable. In women, especially postpartum, there can be rectocele, where the front wall of the rectum bulges into the vagina, trapping stool. Some even need to press on the vaginal wall to help the poop come out. That's not in your head, that's structural. Others may have a rectal prolapse, stricture, or scar tissue from the past surgery or IBD, all of which can narrow the canal or disturb the shape. This cluster often comes with these signs: needing to stress excessively, feeling like stool gets stuck near the end, needing to go again right after, bleeding, burning, or bulging sensations if any of this sounds familiar. This could be your cluster. And here's the thing, you could be doing all the things right: eating well, moving daily, even meditating to reduce stress. But if there is a physical barrier, you might need more than lifestyle. You might need a structural evaluation. Let's keep going. The next cluster is one that surprises a lot of people. It's not about your gut wall at all. It's about your nervous system. So we have looked at functional problems where the gut doesn't move, and the structural ones where something gets in the way. But what if the issue isn't inside the gut at all? What if the message just isn't getting through? Constipation can happen when the communication between your brain and your gut breaks down. This is what we call neurological constipation. And it's more common than most people realize, especially in people with chronic illness, aging, or trauma to the nervous system. Let's say you have Parkinson's or MS. The signals from the brain that tells your gut to move, they are delayed. Same with diabetic neuropathy, where the blood sugar damage slows nerve conduction, or after a stroke or even spinal injury, the gut becomes disorganized. Even without the diagnosis, many of us live in this constant fight or flight mode. The vagus nerve, which helps activate digestion, becomes sluggish. And when your body is always in defense mode, it shuts down non-essentials like pooping. Pause here for a second. Do you have a known neurological condition? Do you feel disconnected from your body's cues, like hunger, fullness, or the urge to go? Do you feel tense all the time, even at rest? If yes, you may be dealing with neural signaling issue. These patterns don't always show up on labs, but gut-directed hypnotherapy, HRV biofeedback, and vagal nerve tuning can make a real difference. Let's keep going. Next up is a cluster that affects millions of people, but often flies under the radar. That is hormonal and metabolic imbalances. So now, let's talk about something that doesn't get enough attention: hormones. These little chemical messengers affect every organ, including your gut. And when they're out of balance, your colon can slow down, way down. Let's start with one of the most common culprits: low thyroid. Your thyroid is like your body's metabolic thermostat. When it's underactive, everything slows: metabolism, energy, mood, and yes, bowel movements, fatigue, feeling cold all the time, dry skin, and constipation. Classic signs. Next, estrogen and progesterone shifts. Menopause, pregnancy, or even your monthly cycle can influence motility. Progesterone, in particular, relaxes smooth muscle, which sounds good until your colon decides to take a nap. Then there is cortisol, your stress hormone. Chronic stress leads to what some call adrenal dysregulation. Your body is stuck in survival mode, and digestion takes a backseat. High stress, poor sleep, anxiety, shallow breathing, it all adds up, and your gut feels it. And let's not forget diabetes. High blood sugar over time damages nerves, including the ones that control your gut. That's why people with diabetes often struggle with both constipation and diarrhea, sometimes in the same week. So quick check-in. Did your constipation start during a hormonal shift, menopause, pregnancy, stress, or a new diagnosis? Has anyone checked your TSH, cortisol, or HbA1c recently? Do you feel wired but tired, foggy, or your body is out of sync? This might be your cluster. Here, the goal isn't just to move your bowels, it's to rebalance the system. And that starts with sleep, nourishment, and sometimes lab work. All right, deep breath. Let's talk about major root cause that flies under the radar, but could be sitting right in your medicine cabinet. Your next cluster is medication-induced constipation. So this next one is a little sneaky. You are doing everything right. You're eating well, drinking water, walking daily, but your gut is still frozen. So we have to ask, could it be your medications? You'll be surprised how many everyday drugs can slow your gut without warning. Let's walk through a few common ones. Opioids. This one is big. Even small doses for pain can cause major gut slowdown. It's called opioid-induced constipation, and it's well documented. Iron supplements. It's helpful for anemia, but tough on the gut. They dry and harden stool. Antidepressants, especially tricyclics and some SSRIs, they affect serotonin, and serotonin controls gut motility. Blood pressure meds, calcium channel blockers like amlodipine are common offenders. Anticholinergics, found in allergy meds, bladder meds, and even some sleep aids. NSAIDs, like ibuprofen, they don't directly cause constipation, but they inflame the gut lining and disrupt microbiota over time. And let's pause for a second. Have you started any new meds in the last few months? Did your constipation show up after a prescription change? Are you on a daily med that you never thought to question? If yes, this might be your cluster. And no, that doesn't mean stop your medication, but it does mean you might need to counterbalance it with hydration strategies, motility support, or talking to your doctor about alternatives. Okay, this next one is close to home for so many of us. It's not about disease or diagnosis. It's about the way we live and how it slowly rewires our body. Next cluster, lifestyle and behavioral constipation. All right, let's be honest. Most of us live in a way that doesn't support healthy pooping. We wake up late, skip breakfast, sit all day, scroll on the toilet, hold it in the urge. We travel, they shift time zones, ignore our body's rhythm. It doesn't seem like a big deal until one day you realized, Hey, I haven't pooped in many days. This is what we call lifestyle or behavioral constipation, where habits and routines train your gut to shut down. It's not psychological, it's physiological, driven by timing, rhythm, posture, and consistency. Here's what's happening. Your colon has a natural rhythm, especially first thing in the morning. But when you skip breakfast or do not hydrate or immediately start rushing or working, you miss the body's natural urge window. And if you suppress the urge often enough, the reflex weakens. Also, sitting too long without moving your core, being distracted on the toilet, phones, books, YouTube, traveling, jet lag, shift work, never having a relaxed morning, all of this confuse your enteric nervous system and your gut starts losing its timing cues. Let's do a gut check. Do you wake up and jump straight into work without eating? Do you ignore the urge because you are busy or not near a safe toilet? Do you scroll on your phone every time you poop? Or worse, for 30 minutes trying to go? This might be your cluster. And the good news is very fixable. For lifestyle-based constipation, we focus on retraining routines, a consistent wake up and wind down time, hydrating before coffee, eating a solid breakfast to activate the gastrocolic reflex, moving in the morning, and yes, screen-free toilet time. And here is the video I have made about how to poop every morning like clockwork, no laxatives, no coffee. Okay, we have talked about movement, structure, nerves, hormones, and behavior. But there is one more major system that influences your poop, and it lives inside your belly, your gut microbiome. That's cluster 7, which is microbiome and inflammatory constipation. Let me ask you something. Have you ever tried fiber and felt worse, more bloated, gassy, tight in the belly? Or maybe you poop a little, but it always incomplete, always uncomfortable? If so, this might be your cluster. And no, it's not all in the head. It might be your gut microbiome or low-grade inflammation or both. Your gut is home to trillions of gut bacteria. When that ecosystem is healthy, it helps form and move stool. But when it's off, like after antibiotics, illness, or years of processed food, things can go sideways. And here's what we see clinically. SIBO, small intestinal bowel overgrowth, gas, bloating, and constipation, often worse after meals. Food intolerances like gluten or dairy, not allergies, but sensitivities that trigger inflammation and motility slowdown. Low microbiome diversity, not enough good bugs to break down fiber or produce short-chain fatty acids that support movement. And sometimes low-grade inflammation from undiagnosed celiac, IBD, or even chronic stress. And here's the kicker. You might look totally fine on the outside. Labs might even be normal, but your gut lining is irritated and your microbes are confused. That's enough to stall digestion. Gut check time. Do you feel bloated or gassy even when you eat healthy? Do you react strangely to prebiotics or fermented foods? Does your constipation come with fatigue, skin issues, or brain fog? You may be dealing with a microbial or inflammatory pattern. This is where we often use stool testing or symptom mapping. Gentle gut healing diets low FODMAP temporarily, probiotics or postbiotics after calming the system, and targeted bile acid support if fat digestion is sluggish. All right, we have covered bacteria, hormones, nerves, structure. And for some people, the root cause isn't physical at all. It's emotional, nervous system based, trauma based, and it's very, very real. That's what we'll explore next, cluster 8, psycho-emotional constipation. Let's take a breath for this one, because sometimes it's not about fiber or transit time or bacteria. It's about safety. It's about how your body learned maybe a long time ago that letting go wasn't safe. This is psycho-emotional constipation. And if this is your root cause, I want to say something clearly. You are not broken, you are protecting yourself. When we live in a constant state of stress, anxiety, or hypervigilant, the nervous system shuts down digestion. It shifts blood away from the gut. It tightens the anal sphincters. And it mutes the signal telling us it's time to go. Over time, the gut-brain conversation goes silent. Some people grew up afraid of pooping, yelled at, shamed, or rushed. Others have trauma histories and the body holds tension as protection. Others are just always on, high achievers, caretakers who never truly rest. They have trained their body to hold in everything: emotion, stress, stool. So let me ask you gently, do you often feel on the edge when you are sitting still? Do you hold your breath even without realizing? Do you never feel the natural urge to poop, only pressure or tension? Do you dread going because it feels vulnerable, painful, or just stuck? This might be your cluster. Here, the solution isn't more fiber, it's nervous system training. What helps is gut-directed hypnotherapy, somatic therapies, breath work, trauma-informed yoga or pelvic floor release, and building routines of emotional and physiological safety. You are doing amazing. We have now explored 8 root causes of constipation, but there are still 2 more, rare but important. One you may have been born with, and one that affects the whole body. Let's talk about cluster 9, genetic or congenital causes. Let's talk about this less common but really important root cause of constipation. The kind that's been there since the very beginning. Some people don't just develop constipation, they are born with it, or it runs in the family. This is genetic or congenital constipation. And if that's you, you have probably felt different for a long time. You may have needed enemas or laxatives as a child, gone days or even weeks without a bowel movement, and been told that's just your normal, or had tests that showed the colon or nerves don't move stool properly. This cluster includes conditions like Hirschsprung's disease, missing nerve cells in the part of the colon, intestinal pseudo-obstruction, looks like a blockage but is nerve or muscle coordination issues, connective tissue issues like Ehlers-Danlos, the gut walls are too floppy, too slow, or familiar patterns where multiple people in the same family have severe constipation. If this is your story, you have probably been gaslit a lot, told it's in your head, that you just need more prune juice, but this is real and you deserve personalized care. This is one of those cases where deeper testing helps. Colonic transit studies, anorectal manometry, full GI workups. You may need a specialized GI motility team and long-term support that goes way beyond diet. But the good news is, once you know the root cause, even if it's congenital, you can build the right protocol, the right team, the right daily routine. You are not doomed. You are just wired differently, and we can work with that. Next up, the final piece of the map, the rare, complex, and systemic conditions most people, even doctors, overlook. Okay, so we have covered the big buckets, from lifestyle to nerves, from brain to colon. But there is one last category we can't leave out. We call it the rare and complex cluster. These are systemic conditions, some rare, some just underdiagnosed, that can quietly wreck your motility. They include things like systemic sclerosis, where connective tissue hardens, including in the gut wall. Mitochondrial disorders, when the energy factories of your cells aren't working. Paraneuroplastic syndromes, where autoimmune gut damage triggered by a hidden tumor. Amyloidosis, abnormal proteins deposit in the nervous system and gut. Lead poisoning or chronic Lyme disease, both can impair gut-brain signaling. And of course, things like long COVID, which we are still learning about. If nothing else on this map has resonated, and your constipation came on suddenly, or alongside other strange symptoms like muscle weakness, numbness, unexplained fatigue, blood pressure swings, or abnormal sweating, don't ignore it. This could be one of the hidden G-pros. And what to do? Bring up systemic causes with your doctor. Request or neurology or rheumatology referrals. Ask for full labs, A&E, heavy metals, inflammatory markers, antibodies. Keep a full body journal. It matters. Yes, these cases are rare, but so is finally being relieved. If you are here, you are not alone, and Gut Sphere was made for people like you who have been to too many doctors, had too few answers, and still refuse to give up. Next, we'll zoom out and tie this whole map together. Because knowing the category is just one step. The next step, action. That was a lot, I know. But if you're still here, then let me tell you something most people never hear from a doctor. Your symptoms are not random. They are part of pattern. And now you have the map. Let's recap what we just did. We walked through the 10 root causes, clusters of constipation: functional, gut disorders, structural blocks, neurological misfires, hormonal and metabolic imbalance, medication-induced slowdown, lifestyle habits, microbiome and inflammation, psychoemotional wiring, genetic and congenital issues, and rare systemic diseases. Now what? The goal isn't to memorize these. The goal is to start matching your experience to likely clusters. So at GutSphere, we have designed this app where you can do reflections and take notes. When did your symptoms start? What makes them worse or better? What other body systems are affected? What medications are you on? What's your current diet, movement, and stress load? Based on the answers, we highlight your most likely root cause zones. Then, we pair it with a personalized protocol education to understand its habits, to address it, and to reflection, to track your progress. And we have tools to share with your provider. So this app doesn't replace your doctor, but it does what most 10-minute appointments can't. It connects the dots between your biology, your history, and your habits. You are not broken, you just haven't had the full map, and now that you do, you can stop guessing and start healing. If you have made it this far, thank you. You are part of a small group of people who don't just want symptom relief, you want clarity, control, and long-term healing. That's what we are building at GutSphere, a place where people who suffer from GI issues finally get a root cause roadmap, a personalized co-pilot app to track what works, a journal to reflect on patterns, a community that actually gets it, tools to help you talk to your doctor with confidence, because you shouldn't have to choose between self-care and clinical care. You deserve both. I started GutSphere after a lifetime of GI struggles, chronic constipation, hemorrhoids, embarrassments, misdiagnosis. I was declared dead at 9 months old. I was afraid of every road trip, every airplane, every new food, and for years, nobody could tell me why. Until I stopped chasing one size fits for all fixes, I built my own map, I studied the science, I tested every tool, and I shared what I learned. First in a book, and now through GutSphere. So if you are ready to stop guessing, you can join the app. Download the free app, try the journal, or just binge the next video. We'll be right here. One habit, one insight, one poop at a time. We heal together. Check out the links below to get started. And if this video helped, share it with someone who needs it. I will see you in the next one.